Good morning, everyone, and I'll call the meeting to order of the Community Justice Collaborating Council. Thank you all for your timeliness. We do have a quorum, so we can proceed with the meeting. With that said, the minutes from our May 9 meeting were included in your packets or online. Are there any additions, corrections, or deletions to those minutes? Hearing none, they'll stand approved as submitted. Public comment. I know we always have folks from the public who come to these meetings, and so is there anyone who would like to make public comment? Any public comments? Hearing none. Under new business, we're going to defer item 1 because the person we're recognizing isn't here yet, but hopefully will be arriving shortly. But with Judge Garrity's departure, we're also very pleased to welcome Kyle Schaefer, who is the new municipal judge in Hudson, having replaced Judge Garrity. Judge Schaefer, I think many of you know, is an attorney with Willow River Law. He practices with Kate Avalos, who is our vice chair of this body, and in addition to his work as an attorney, he serves in the military, and so we thank him both for his service now as a judge, his work as an attorney, but also his service to his country. So we welcome Judge Schaefer, and we'll get him lined up with the subcommittee as soon as we've had a chance to chat with him. We also have some folks subbing in today. Derek Dravis is here on behalf of the Department of Corrections, and David Olson is an assistant state public defender here on behalf of that agency. And then Charlie Forbush from Western Wisconsin Health is here on behalf of Ms. Peterson. And I think that's all. Judge Waterman. Oh, Judge Garrity has arrived. There she is. So with that said, we'll then move into the first item of the agenda. As I said, Sue Garrity I've known for a very long time. I knew her as Sue Schleif when she worked in the district attorney's office for a few years, and then I think we all know Terry Garrity had the good fortune to snag her, and she then went into private practice, primarily practicing in family law. One thing I always knew when Sue appeared in front of me was that she would be well prepared and would certainly present a strong and compelling argument. She then decided to venture into the world of being a judge and served Hudson for a number of years as a municipal judge. I would say Hudson was not only the beneficiary, but the 10th district, where Sue was the liaison for all of the municipal judge in the district, also taught at the state level, and so her work as a judge was recognized certainly by others in the state. We then, a few years ago, made a decision that we should have a municipal judge on this body, and Sue certainly came to mind as the person who I thought, and Phil and others thought, would be a great addition to the CJCC. But with her decision then to retire as a judge, her status on the council then likewise lapsed. And so I'd like Sue to come up. We have a certificate of recognition that reads simply, "This certificate recognizes Sue Garrity for many years of service to the Community Justice Collaborating Council of St. Croix County. Sue's dedication to improving the lives of citizens in the county is undeniable, and we thank her for these contributions." Dated this 11th day of July, 2024. So, Judge Garrity, come up.
Thank you for the really very kind words. I greatly appreciate it. It's really been an honor to serve with this community. I've really enjoyed working with you all. I think the work you do is phenomenal and fantastic, and I hope it all continues. And if I can ever be of service in any way, please don't hesitate to contact me. I'm still around. I haven't, died. I can still do things. So if you ever need help, but I think Kyle's going to be a great addition. I know he's already picked up the baton, and he's running with it in municipal court, and I think he's going to be a great judge for the city of Hudson. So I appreciate your including the municipalities in that. So thank you very much.
Thank you, Sue. As she said, we're not going to let her go per se because she's continuing to serve on the Child Protection Subcommittee of CJCC. And we had a meeting the other day, and her contributions continue to be extremely valuable to that body. There, I think, is at least an opportunity to talk about, under item 2, our subcommittee membership. It kind of surfaced when we recognized that we have county board members not only on this body, but on, I think, every subcommittee save the treatment court subcommittee. And so there was a discussion, I know, at Judge Nordstrand's recent meeting about how do we go about expanding membership for subcommittees, you know, how do we decide who should be members. And I think that committee decided, you know, directed back to the full group here to talk about whether we think that first we should have county board members on our subcommittees, and then secondly just general membership. So I'm going to open it up, and maybe Judge Nordstrand, you can kind of fill in as to where things are at least from treatment court.
Well, we did have a meeting and talked about this. We often have county board members, in particular a couple that are particularly interested in treatment court, come to our meetings. And the committee voted to support adding a county board member to the treatment court subcommittee. Formally speaking, we need to amend our policy manual to accomplish that, but I think we could entertain a motion here today if the body was interested to simply allow us to amend our policy manual to add to our list of membership in the treatment court subcommittee a member of the county board, and then the appointment process would be up to the chair, or the normal process. But having that done, I think it's essential for us to have a connection to the county board, who provides all, you know, the vast majority of the funds that we have to use in treatment court to do what we do is provided by the county taxpayer. That we get some grants, but it's largely that, and I really think it's important. And I will say this, as a treatment court judge, I'm so pleased at the number of county board members who come to treatment court. We had 2 of them at a graduation yesterday. They both spoke with the graduate. That was meaningful, I think, to that particular person, and we often see them there. I mean, so, and often they talk to me afterwards about their impressions, and I appreciate all of that. So if we could entertain a motion to add a county board member to the treatment court subcommittee, I think that would be a good idea.
Thank you, and I think arguably what I would suggest is that the motion be to have county board representation in all of our subcommittees. I think there may be one other. I'm not sure if domestic violence has a county board member or not.
Supervisor Telejohn, are you on the domestic violence subcommittee?
I'm chairperson of the Health and Human Services Committee. That's why I'm here.
Okay, sure. So that subcommittee may need to add one as well.
So is there a motion then from amend our policies and procedures to add a county board member? To add a county board member to our standing subcommittees.
I would be happy to make that motion.
Thank you, Chairman Long. Second by Sheriff Knutson. Is there any additional discussion? Here.
I think it's a great idea. The connection to the county board is really critical, so that all the supervisors have a good idea of what services are being provided and the extent of the services, and that connection is really important. So thank you.
And I can speak certainly for the Child Welfare Subcommittee. Supervisor Leaf is on that subcommittee and really offers valuable insight, not only from the perspective of a county board member, but a citizen in terms of the work of that group. So I can certainly echo what Chairman Long suggested as the benefits to us. So, any other discussion? Hearing none, all those in favor signify by saying aye. Aye. Those opposed, same sign. Carried unanimously. Thank you. Justice Support Services Staffing Update. Phil.
Thank you, Judge. So next Monday, the 15th, next Monday the 15th, we have a new pretrial case manager starting in Justice Support. Samantha Anderson is her name. She'll be joining us from outside of the county. She comes with 4 or so years of case management experience outside of the justice system. So we're excited to have her start next week, and she'll be up and going very quickly in the courtroom and doing PSAs. So we'll take her around and introduce her to everybody starting next week.
Thank you. Any questions, Phil, about staffing? Testing updates. Phil.
Sure. So for the last 3.5 months now, well, I guess it's been close to 4 months, we have been doing remote testing in New Richmond at the Services Center. We started back in March just on Tuesdays. We opened that up in May to Tuesdays and Fridays. I have just some numbers here, percentages and raw numbers of tests that have been done at that location over the last 3.5 months. So this is through June 30th. So roughly 150 tests done up there over that period of time. So again, that's over 1 or 2 days per week. To give some context to that, we had about 550 tests done here at the government center. So, it's about 20% of the testing currently is taking place at the Services Center. So I would expect when we run these numbers again for the next quarter, the next 3 months, we'll probably see not quite 50-50 on those percentages, but maybe more like 60-40. So it seems to be going well. We'll continue to report back numbers. Anecdotally, it seems to be going well. I haven't heard anything negative. Clients seem to appreciate that option in New Richmond, especially for clients that live up there. As far as Tuesdays and Fridays, I think it allows us to kind of spread out a little bit and still offer services here. But those are kind of the big updates on testing.
I had a person in court on Monday who I decided we should be testing, and he said, well, I don't have a valid license. He said, I'm not going to be able to get to Hudson to test. I said, well, isn't it your lucky day? You live in New Richmond. I know where you live at Croix Apartments. It's within walking distance of the service center, so we're going to set you up with testing. And he kind of slumped in his chair, but we accommodated that need for him. And again, as I think I've shared, New Richmond is kind of the hub for human services and what we can offer: mental health, substance abuse, many services, child protection. And so I think having that testing in that hub where we offer all of our other services really is valuable. So kudos to Phil and Bob Rarrett and others who helped accommodate and get that set up and running. Any questions of Phil about testing or testing at New Richmond? All right, adult treatment court updates, Judge Nordstrand and Kate.
Well, why don't I have Kate give the overview first? What would you like to say?
I was going to follow you.
All right. Well, all right. I've got one topic I wanted to bring up. We've been doing well in increasing our numbers back from the COVID times and the troubles that caused, et cetera. We're up in the mid-teens now, so we've got some space to grow, but we're moving well towards that number of around 20 or a little more, which is our target, I think. One of the things that's occurring more frequently now that I think you should be aware of is we're having treatment court participants who need higher level treatment than intensive outpatient treatment. They need inpatient. And this is something we haven't really experienced much in the past. I don't know why, but it's frequently happening that folks who have come into treatment court, And it's not surprising. Lots of folks need inpatient treatment in order to be successful in their recovery. And we shouldn't be surprised that the highest need, highest risk folks from St. Croix County's justice system might fall into that category. But we put them in intensive outpatient treatment to start with our provider Programs for Change. If they are consistently, constantly unsuccessful in staying, having sobriety, if they're not getting the benefit of the treatment so that they're making progress, they get discharged from Programs for Change. We had one happen yesterday. And so then the question becomes, what do? We don't have inpatient treatment readily available, and so we're looking for different ways to approach that. And the Department of Corrections provides treatment, but it takes a long time to get in, 6 to 8 weeks, 12 weeks. We've had occasion in the past where we've had to have people, because of the treatment provider's requirements, stay in custody, courtesy our sheriff, until their bed is available in treatment. That's a lousy system, but we've done that. On other occasions, we've had people just out in the community waiting. So they're not getting treatment, they're coming to treatment court, checking in, generally being positive in their tests over periods of time, and then we wait for weeks and weeks and weeks to try to get them in. So we're looking for alternatives, and I think Kate's got some potential news in that regard, because we want to develop, as a treatment court, relationships with treatment providers, inpatient treatment providers, that could perhaps provide services on a more expedited basis. But the challenge there is our folks generally have Badger Care, Medicaid type insurance. That covers treatment. It doesn't cover the cost of inpatient housing, room and board. So it's not practical. They're not going to be able to out of pocket $10,000, $20,000 for 30 days of treatment costs for housing. So we're looking for alternatives, and I think, I wasn't here last time, but you heard from the retreat last time, and that's potentially an option, because their services, a 12-step recovery program, is much, much cheaper than traditional inpatient treatment. Retail price is $6,900 for a month. And I think they would be willing to discount, perhaps, for services. So then we could have perhaps an option for some sort of 12-step program that would be residential for a period of time. And then Kate's looking, she's going to maybe have something to say about perhaps there's a supplemental TAD grant where we could find some funding for either that kind of treatment or to help pay for housing in another kind of treatment and develop a relationship there. I just want you to know that's an issue. It's happened 4 or 5 times in the last year, at least. And that's out of a fairly small, 10 to 12 to 15 folks. So it's common, and it's continuing. And I'll say one last thing about the retreat, because I wasn't here last time. I am a graduate of the retreat. Where I found sobriety in my recovery now 17, 18 years ago was at the retreat in Wayzata, Minnesota. So I'm a big supporter of that, and I think they have something to offer. Not for everybody, right? 12 steps aren't for everybody, but for those that are interested in that and those in our program that might be willing to participate, it could be a good option to step them on their way towards recovery. So maybe, Kate, if you've got other things you want to talk about, and perhaps that TAD grant opportunity?
Sure. It kind of goes into our next business item with the TAD grant. Lisa will help me talk about it. So there is a surplus in funding for next year for the current TAD recipients. We will be applying for that. We will be asking for a large sum of money, and most of it going towards substance abuse services. So for room and board, if we need them, for assessments, and our clients don't have their insurance up and running yet, that would cover those costs. So we are hopeful that we will be able to get that come January of next year. And then that would help us not have to wait 8 to 12 weeks, put people in custody because they aren't safe out in the public. So hopefully we can obtain that and get them on the road to recovery faster.
Thank you. Any questions of Jen Strand or Kate about adult treatment court before we segue into any other TAD updates? Lisa, Phil, anything else on TAD?
Just to talk about what Kate was discussing, it is $1 million is what they are surplusing for 2025. So there's some funding for us to ask, and then what Kate had talked about, we were going to do that for diversion and treatment court. Diversion generally does not have funding for any of our clients. They have to pay out of pocket or find the funds on their own to get AODA assessments. So we felt like a large majority of what we would be asking for would go to treatment court, and then we'd also put the pool of money together for both programs. And then we would also put some funds for training, and we have a data specialist for the programs that we split between both programs for 12 hours each week. We want to see if we can double that and have that be 20 hours for each program, specifically because DOJ is really looking at outcome and performance measures, which we collect through our core reporting system to the Department of Justice, and I've been on their diversion outcome and performance measures subcommittee. The past 3 months, we've looked at outcomes and performance measures for diversion programs specifically, because we don't have a lot of that same type of policies and procedures that treatment courts have. So we are looking at what we need to collect, what we should be collecting for diversion programs in regards to the clientele that we have versus what treatment court has. And we're developing some more specific measurements. So that's something that we're going to be ongoing, and hopefully we'll be able to implement more of that, and then with the data specialist we'll be able to collect that information and be able to have more reports on what's going on within the programs.
Are these surplus dollars only for existing recipients? I mean, they're not opening it up for new applications?
No, it's for existing recipients. So I think that Phil, Kate and I met yesterday, and I think that we discussed that it's not a huge amount of money we'll be asking for additionally. It'll be about $60,000 total. So out of $1 million with 54 programs, I mean, all we can do is ask and see how it goes.
Thank you. Phil, do you have anything else you want to add?
Just administratively, our Q2 report is due to TAD tomorrow, to the Department of Justice folks. So Kate, Lisa, and I are working on finishing that up, or Lisa and Kate are probably done, and I'm finishing up on my end. And then Monday, our pre-application for 2025 is due, so that's what we met about this week. And so we will have that in, and then we will know more as far as our request for additional funding, probably in August, because then that'll set the table for our actual application, which is due in October. But I would just sum up what Kate and Lisa said. I think the idea is for us to ask for a pool of money, pool of resources to be used for justice-involved individuals to kind of fill that gap that exists for treatment court diversion, mainly, that we can then manage internally. And if we have folks that need residential treatment, if they need an assessment in the jail, whatever that looks like, I think it could benefit our clients.
Any questions about TAD grant? Thank you. Matt grant update, Phil, and Matt again, I think medically assisted treatment, so Phil.
Sure, I'm just going to touch very briefly on our MAT program in the jail. And thank you. Touch very briefly on our MAT program in the jail, and then you're going to hear a presentation in a little bit about MAT in the community from Western Wisconsin Health. So our medication-assisted treatment program in the jail is doing very well. We're clipping along. Again, this is the program that Kathy Borgschatz helped start 18 months ago, roughly. But we are coming down to the last 60 days of funding from the Department of Justice for this program in the jail. I don't know what it looks like starting in October as far as a funding source, but our process seems to be going well. We've got public health on board, behavioral health, jail social worker. So I think we just need to continue to have discussions about if we want the MAT program to continue in the jail, which you know, there's a lot of value to that as folks transition then into the community. What does that look like from a funding standpoint for us? But we're grabbing people that are vulnerable, right? They're in jail and they are oftentimes, you know, in a space where they are ready to start a MAT program. And so we've had really good success with that, and we hope to continue that moving forward.
Any questions about Matt? Thank you. Substance use disorder assessments in the jail. Kate, Phil, I'm not sure who's going to take that.
Do you want me to go? Okay. Okay, so just talk a little bit about the last 6 or so months, maybe even further. We have struggled to get folks assessed in the jail that need that substance use assessment for entry, at least a pre-screening into the treatment court. So that's kind of the one pool of individuals. The other are folks that may be asked to get that assessment as part of a court order. We have been funding some of these with our MAT grant, and with that, for treatment court purposes, we've been using Berkwood, have been coming to the jail and doing those assessments for us, which has worked out great. We've really hit a stride with those. They cost about $450, so they're not cheap, but we've really developed a nice partnership. It's seamless. Kate will contact them within like usually 48 hours. They're able to get into the jail, get that assessment done, and get that information back to Kate. We've also, our government center case manager, Kara Aubert, has been using this for folks as well. So we've got a nice process, but our funding is running out. So this is where I think that TAD funding could possibly come in for treatment court, for perhaps even diversion. So we've really got the process down. We just need to achieve that funding source, which I guess is the problem a lot of folks experience. Anything to add on that, Kate?
Judge Norstrand.
Just a reminder to everybody that the issue for people coming into treatment court is really folks that are on a probation hold from the Department of Corrections. So folks that are being sentenced into treatment court from, you know, an active case that hasn't been resolved, that's not a problem because the judges can facilitate them getting to an assessment, generally speaking, at Programs for Change, which is our treatment provider, even if it's a furlough, to get over there and get the assessment and come back. We don't have the power to get them out of jail if there's a PO hold from DOC, and DOC won't let them out to go get an assessment. So that's the problem. Just so we're clear, in treatment court context, that's what we're trying to solve for.
Any questions or comments about? Any questions or comments about the substance use disorder? Yes, Mr. Rarick.
Just a comment, Judge. We are year three recipients of a state opioid response grant. If we get that grant next year, or in this fall, I should say, that would be an option possibly for helping to fund the MAT program in the jail. So we'll have to see if we get that grant again, and if we do, then we'll look at potential funding. I believe that was a conversation we've had, Phil.
That would be wonderful news. So, recap from the NCJA Enhancing Public Safety meeting that Phil went to.
Sure. So back at the end of May, the National Criminal Justice Association put on for the first time a kind of a work group for folks from around the country that are CJCC or criminal justice planners over in St. Paul. So it was great because it was very local and it was free. So I went over, and the idea was to just talk with other folks that do the type of work that we do. So CJCC work, criminal justice planning. And so I think there are some things that we can do to continue to promote involvement in our CJCC. Here, I think, you know, things are great in our subcommittees as well, but one of the areas I'm interested in is how can we continue to engage the public and get folks from the community to be involved. I've told this story before, but when I was an advisory member on this board years ago, when I was a faculty member at UW River Falls, I found out about the CJCC because I was looking how to register our dog in the county. So I didn't even know that the CJCC existed, and that's no fault to anybody, but I think there are some things that we can do to get the messaging out. One thing I would like to do maybe in the future is to take our meeting out into the community and do it at a community center somewhere, and I think that would maybe break down some of the barriers that exist for folks that may not want to come to the Justice Center for whatever reason. So I think there are some things that we can do in that regard. But it was very eye-opening. So it was kind of a broad spectrum of CJCC and planners that were there at this meeting, folks like us that were very, very well established for a decade and moving along. And there were jurisdictions from all over the country that they were really at the very beginning. And some that were really struggling to get board support. I think that's one thing that I took away from the meeting is for the 20 people sitting around the table and in the audience, we have really good support within these walls and within the government center and the services center, which is wonderful. I learned that that's not the case in every jurisdiction, that they struggle to engage their stakeholders. I don't see that, so I'm very, very pleased there. But I think I can do more to engage the community and get folks involved, whether that's through grant processes or whatever it may be, community service. We are also one of the very few, if any, CJCCs that are community justice, which I think is really much more welcoming than criminal justice. So I think when this board was created, that was done intentionally, if I had to guess. So people were, I think, you know, it was just a nice learning experience to hear what's going on and like I said, some of those areas of growth for us.
Any questions or comments about that? But I concur with Phil that getting our message out, I think, is not only to the benefit of this group, but to those we serve and all the stakeholders. So if anyone has ideas or suggestions, taking our meetings on the road might not be a bad idea. New Richmond is always happy to host, and it's convenient for me, so I'll volunteer to explore that as an option. So with that said, we'll move into one of our formal presentations today. We have Donovan Schumacher here from the Wisconsin DHS, and I believe he and or Bob Rarrett asked to have him present to us. So I'll turn it over to Mr. Schumacher. Welcome.
Welcome, everybody. Hello, everyone. And yeah, thank you for the invitation. It started with Phil, and we do a lot of work with human services counties in our region. I'm going to just kind of try to break that down for you a little bit to explain our role. So my name's Donovan Schumacher, and I work out of our Eau Claire Regional Office, and I work for area administration. We're a subgroup of the large Wisconsin Department of Health Services. That's 6,000 employees and includes all the institutions in our state, Winnebago Mental Health, Mendota, several others. And it also includes our department, area administration. Area administration's been around for quite some time. And I kind of like visuals, so I don't have a lengthy PowerPoint. I thought I could just, talk with you and really give you a broad overview of our role with the counties. But up front here is a map of our 5 DHS regions. And as you can see, the gold counties is where St. Croix County it resides. And there's 18 counties in the western region. So there's 3 of us in every region. And Zach, Michelle, and myself, we serve the western region counties. And again, we're based out of Eau Claire. And St. Croix County is one of the counties that I'm personally assigned to, just to provide assistance and coordination. So Wisconsin, the Department of Health Services, for this group, the services that fall under DHS, it includes public health, it includes income maintenance, birth to 3, disability services for children. But for this group primarily, it's important for you to understand it also includes all the behavioral health programs that your folks utilize in your substance use disorder programs. And as we know, Wisconsin is a county-based system, 72 counties. So the Human Services Departments primarily, facilitate the psychosocial programs that are established by rule under DHS. That includes comprehensive community services, community support, and your behavioral health and substance use disorder programs. And there's also private providers out there that we provide assistance to because they need to get certified with DHS to provide care, get reimbursed for medical assistance and things of that nature. So that's kind of the broad umbrella. But what I really want to highlight is the relationships that we have with County Human Services. That's our primary role. So every in state government, it just gets larger as we go, right, from county to state to federal. It can get real confusing. And so every program has, say, a Madison central office contact or several to kind of help facilitate programs, send the grants out, answer questions for counties. But what we have a really unique opportunity to do is work directly with the counties, and we're kind of that bridge between Madison and where the work gets done, and that's right here in the communities. So that's why I'm here today in person. We try to get out in the counties in person by invitation as much as possible. The nice thing about my job is, I work for the state, and sometimes people kind of look at me a little cross-eyed when I say that. I really consider myself a regional worker. So we're that bridge builder. We're that direct contact between the counties and Madison. Counties do a lot of work directly with our central office folks in Madison as they build relationships, but a lot of times they start with us. So I'm very familiar with Bob and his staff at St. Croix County. We work very, very closely with your Human Services Department. Another thing that we do is we really try to bring the counties together. Sure, we have these state programs. We can help explain roles, discuss grants, but honestly, I've been with our administration for 10 years. Prior to that, I had 20 years of county human services experience in our region in Washburn County. And I really see the magic, so to speak, happening is when we bring counties together, they network, they learn from one another, they talk about the programming that they're facilitating, and they really put things together very quickly. Now, as we all know, problems get real complex, right? So I'm just going to give you a couple examples of where we were able to maybe assist counties in moving things forward and facilitating some change. One example is a few years ago I was providing some technical assistance to one of your CJCC subcommittees, and I see some of you here. And the focus at that time was expanding inpatient beds for our region. And after several years, the directors in our region, and it was facilitated right out of St. Croix County is where the ball kind of got rolling, met with legislators, and they got a grant together that was intended to bring additional psychiatric beds to our region through HSHS. That might feel like a poor example because, as we all know, HSHS ended up closing and the beds never materialized. But that's an example that we saw come together just out of a lot of advocacy from the Western region. Another example is just when grants come through, they come in. Bob referenced a grant that he's looking at. St. Croix County has been very aggressive in facilitating grants, bringing more services to your consumers in your community, which is phenomenal. It's really hard to sift through those grants, so we try to keep an eye on them. And if we feel it might be a good fit for a county, we might highlight that to a county. An example several years ago was, again, on the emergency detention need and the psychiatric assessment need. Hudson Hospital took the lead on writing a grant that is still up and running, providing emergency department televideo assessments in your 8 hospitals out of St. Croix County and your surrounding counties. And that's a 3-county partnership with St. Croix, Polk, and Pierce. So my role in that was really just to kind of bring those counties together, help answer their questions, and it materialized in that service is still running today. So that's one example. Another example, which has been a whole lot of fun, we facilitate regional meetings. So once a month, we bring all the directors together. It's either in person or Zoom or a combination thereof, and they collaborate. I facilitate regional meetings with behavioral health managers. So 2 years ago, we started networking meetings that includes behavioral health managers, all 18 of them from the Western region, and also CJCC coordinators such like Phil and his colleagues in the region, and some of the treatment court and drug court personnel. So we brought them all together. We have 2 meetings a year, set the agenda just for mutual, items and topics. One of our last ones, we brought our DHS expert on 980 and supervised release, just to kind of talk about that program. And I'll just summarize it that, we're all serving the same folks. There's a lot of energy right now around serving the justice-involved individuals. It's no secret that we're all serving the same families and the same individuals, whether they're coming in and out of the jail system or not. So county human services departments just have become very innovative in coordinating that. A lot of programs in our region have really evolved as far as like reentry, working with those inmates, prior to them being released so that they're successful out in the community. So it's challenging. We have a lot of issues. I won't necessarily go into those because I'm sure you're all aware of them. We have kind of a fun little saying. There's 15 of us on our team. We say the West is the best. I personally believe that, and the Western region is resilient. We face some really big challenges with the meth epidemic and the psychiatric beds, utilizing Winnebago, trying to keep our folks in the region. The state, it's kind of like a big ship where you can move it, but it moves a little bit slowly. But I really feel a big part of our job is sending the message, what's going on in the Western region to Madison, so that they can focus on programs. I think we're making some progress. A big outcry has been, let's keep our folks that need that acute inpatient care in their region rather than sending them to Winnebago. We just opened up 5 crisis stabilization units. The one that serves this county is in St. Croix. It's, I believe, a 12, maybe 15-bed facility. Not a solution to all of our problems, but it's a step in the right direction. And then DHS was just commissioned to develop a new rule out of the 2023 Act 239, if I'm reading that correctly, and that's to establish crisis and urgent care and observation facilities. So a new rule needs to be established, but that's also focusing on trying to meet the needs of our folks in the region rather than Winnebago. And I tell you what, personally, when they get to Winnebago, I think they get incredible care. It's just that distance and that 4-hour drive and secure custody, and we're really trying to make progress in that area. So I don't know if I've hit 10 minutes yet, but that's really all I had to say. Bob or Phil, if you have anything you want to add or any questions from the group.
One clarification.
Sure.
Where is it? You said the 15-bed facility, St. Croix, what, Falls?
Yeah, the 5 facilities are actually located in the locations Waukesha, Beaver Dam, Wausau, La Crosse, and Madison. The facility that's targeted to serve our region is La Crosse.
La Crosse.
Yeah.
Thank you.
And that maybe brings up a good point. Is there, again, any effort to make it more regional? I mean, La Crosse is still 2+ hours away. You heard we don't have any inpatient substance abuse providers in this area. Juvenile detention continues to be a huge issue for us. We have Eau Claire, Marathon, La Crosse. So is the department looking at trying to come up with more regionalized services, whether substance abuse, juvenile detention, mental health? Because shipping people to Winnebago, I don't disagree they get good treatment, but it's a challenge.
Yeah, no, absolutely. It's definitely the short and long-term vision of DHS to serve folks regionally. I tell you what, the county's doing an incredible job diverting in the first place just with their front-end services. CCS, Comprehensive Community Services, that rolled out 10 years ago, has really made an incredible change in our communities, including St. Croix County. Some of you know it's a fully funded system, provides case management, substance use disorder, and behavioral health services in the community to folks. So I think our crisis numbers have stayed relatively the same, but across the state and in this region as well, when folks need that care, the acuity is much higher. In other words, it's more intense. Folks that get in, are held on an emergency detention now, by and large, they need that care. There's absolutely no other option. 15 years ago, I could say there were probably some folks that were chaptered that may not have needed that care. I think those days have been gone for quite some time. So, yeah, to answer your question, it's certainly something that is a strong priority in the state. Need legislators to come together and help us solve those problems. I think there's some bipartisan agreement, but as we all know, sometimes a lot of disagreement on how to make that happen. So, yeah.
Ms. Amos.
I just want to update the committee. So the county board did pass a resolution urging legislators to approve immediate funding for inpatient psychiatric care in Western Wisconsin. So that was passed a month or two ago.
Last month, yeah.
Okay, and then the Wisconsin Counties Association has recently taken up this issue also, and so they're focusing on getting all counties in the western region to try to pass resolutions urging the legislators to establish in the 2025 to 2026 legislative session budget monies to establish some type of, western region inpatient unit. And I also just want to thank Donovan. He's been very helpful to Corporation Council. I've worked with him for the last 10 years, and so he and his staff provide informal decisions regarding residency. If there's conflict between counties about Chapter 51, is it our resident, is it Pierce County resident, who should be taking that on, and also guardianship cases. So Donovan and his staff are always very responsive and helpful, and he does try to get the counties to work together to resolve the residency issue so we don't have to make the formal determination. So I want to thank him formally for that.
Thank you. Bob, did you have another comment you wanted to make?
Real quick, Judge. About 3 years ago, we did attempt to apply for a grant that would have funded a withdrawal management center here in St. Croix County. We didn't get the grant, so we weren't able to move forward with that. But since then, we've really advocated strongly with legislators, with the state, to look at the possibility of one of these urgent care crisis stabilization facilities in this area, whether it's St. Croix County or a surrounding county. The legislation that Heather and Donovan referenced requires writing rule language around this particular level of care. So I volunteered to be on that committee or to advise that committee on rule language. So did Chief Young from River Falls and others. But if that rule language is developed and we are able to move forward with some sort of funding around these crisis stabilization facilities based on what the legislature approved, we're looking at maybe a year or two before that's a possibility, but it is in the works at least.
Thank you. Next item on the agenda, please.
Mr. Chair,
Sheriff.
I just want to add to that, as we talk about the resolution, Polk County Sheriff Walker just reached out, and it sounds like Polk County wants to make a push in their area for whatever it might be, so I won't speak for them, but so we're, Lieutenant Coleman is putting together 2023 and 2024 emergency detention statistics on time, which drew up one of the old emails, just as a reminder. 2021 and 2022, as we put those emergency detentions together, the average emergency detention took 13.63 hours. The minimum was 4 hours. Those would probably been Amory. And the max was 22 and a half hours. Just to throw this back out there again as we continue to push this.
Thank you. Any other questions or comments about that topic? Next, we're pleased to have Dr. Nate Schwartz as well as Katie Johnson from Western Wisconsin Health here to talk about, as I understand, substance use evaluations and assessments and some other matters. So welcome, Dr. Schwartz. Welcome, Ms. Johnson.
It's minimized, that PowerPoint.
Well, good morning, everyone. My name is Katie Johnson. I'm the clinic social worker at Western Wisconsin Health, also a clinical substance abuse counselor.
I'm Nate Schwartz. I'm a family medicine doc at Western Wisconsin Health in Baldwin. I see all kinds of patients from birth, and I have a couple over 100, and then wanting to see people with all kinds of problems, including those with substance use problems.
So we're here to present on the Recovery Support Solutions Withdrawal Management Program. This is a partnership between Western Wisconsin Health and St. Croix County Health and Human Services, providing withdrawal management support and medication-assisted treatment. We do this in the primary care clinic, so using the medications in combination with counseling, behavioral therapies, and peer support for the treatment of substance use disorders. Some of the supports that we offer alongside the alongside the provider are peer support specialists within St. Croix County, behavioral health therapists, substance use disorder counselors, and then myself, a social worker. And just to talk a little bit more about those supports, so we have Dr. Schwartz, the primary care provider, providing the medication-assisted treatment alongside any other medical needs. Peer supporters really provide that kind of lived experience, people in recovery themselves, meeting more on an individual basis, working with them, whatever they need help with. Substance use disorder counselors, whether that is through the St. Croix County, or we also have a substance use disorder counselor that can meet with them at Western Wisconsin Health as well. And then, I'll work to coordinate any other community services if they need more treatment, if they need, financial resources, really kind of anything is fair game there. So looking first at the 2023 volume, program began around June of last year. I started in November, so I wasn't here for the beginning part of it. But looking at the beginning, 4 visits, 2 no-shows, 4 new patients. You can see there was a lot of patients in the beginning for there in June and July. August, 2 visits, September, 2 visits, October, 1 visit. Picked up again in November and December with more visits there. And then you can see in 2024, we had quite an increase in the amount of visits and the amount of patients. So, looking at January, there were 4 visits, February 7, March, there were 10, April, we rose to 22, really because we had 9 patients that month, so they're usually seen more frequently towards the beginning of their withdrawal because they're needing more care. And then the visits kind of lower, when there's not as many patients. And then right now, there are currently 11 active patients. Looking at their substance of choice, a little bit of variety. So we've got a few alcohol, about 5 opioids, 3 methamphetamine. Looking at the amount of time that they've been in the program, there's 1 that began in August, 1 in January, 1 in February, and then 4 began in April that are still in the program, 1 in May and 3 in July. And looking at who is involved with other program support, there's currently 3 that are using the peer support specialists and 4 using the substance use disorder counseling. So, sometimes the patients have other treatments. Some of them are already working with treatment court or already have other therapies in place as well. And our process to enroll in the program, contacting Western Wisconsin Health to set up an initial visit with our program. The number on the brochure, if you guys have seen the Recovery Support Solutions brochure, comes to me. So I'll set up the initial visit and discuss if they want any other program supports at that time. I also go in at the initial visit to do a brief assessment brief triage assessment to get that diagnostic information. And then we refer and connect to support as needed. So if they need substance use counseling and they're in St. Croix County or peer support, I would contact them and ask them to reach out from there. Looking at some of the challenges and strengths we've had, there is a frequent no-show rate. You know, a lot of times people either don't come to the initial or they will reschedule. That is a problem we have had. Some individuals refuse other support or maybe even only want the medications, thinking that will do it for them. Some issues with the cost of medications. Now needing prior authorizations causes some barriers for our patients. So Vivitrol, for example, you know, someone can't just come in and get Vivitrol very easily, I should say. We've done it, but it's difficult to get the prior authorization the same day. And then sometimes we struggle with the flow from if they come into the emergency department, go to detox, you know, the amount of time it takes them to actually get into the outpatient treatment, getting connected there. Some strengths we have, able to get patients in very quickly. Dr. Schwartz is really good about squeezing people in, even if he's got a full schedule. We've worked out a process in the clinic that's been working pretty well, being able to get people connected to services in a little bit smoother way. Starting to be able to utilize our substance use counselor, behavioral health provider on site, especially when people aren't in St. Croix County. We have a lot of supports that we offer. Providing the harm reduction supplies, so we provide them a Narcan kit at the initial visit, offer information on, you know, fentanyl test strips or other different harm reduction, and then starting to receive more referrals from other organizations, so you know, other emergency departments, peer supporters, other counties, that kind of thing. And looking at some of our next steps, we're continuing to search for and apply for grant funding. So I was talking about, I was looking for more grants to fund this work. Continuing to look at harm reduction, providing Narcan kits, other information for harm reduction services. There has been more frequent, I would say, treatment court or people asking for assessments, kind of the legal side. So potentially looking at, you know, options for more comprehensive AODA assessments. Then we are hoping to begin outpatient group therapy by the end of the year for individuals with substance use disorders. This is just as of last week, and I don't know if Charlie maybe wants to touch on this more, but utilizing the RHC exemption DHS 35. So we recently found out we can't receive the DHS 75, so hopefully going through with this we'll actually be able to provide that outpatient treatment as well. Obviously that's a need for our patients too, so. All right, I'll open it up to any questions anybody has.
I just want to jump in quick. When you think about like the numbers and how things have been going with the program, things kind of had that taper off and lull, and then numbers went way up. And having Katie here, being kind of the heart and soul of the program, I really appreciate working with her, and she does such a wonderful job in getting people connected to care within our clinic, but then also in the community. So this is something that could not happen without her. She's, like I said, the heart and soul of the program. The medical part of it is not that difficult or complex. It's really all of the other things around it. And so having all of those other things, the peer support, the connection to resources, is really the key, I think, to success, long-term success for most people who live with substance use disorder.
So if we have someone in our jail who's on our MAT program and are being discharged, or they've served their sentence, or whatever the case, would it be a logical referral then to your program from there?
I think so. I would love to see them, and having that set up, or like having them have the information at least before they leave the jail to say, this is your next step, we'll set you up, you're going to see Schwartz this day, I think would be awesome to make that a more seamless transition.
And are the costs, Badger Care, does it pay for your program as well as private insurance? Apparently would.
Yeah, Charlie, speak more to the cost stuff than I can, but I think like my fees all get paid by Badger Care, and then Badger Care has pretty good coverage for most of the medications that we use. Sometimes we just have to, time-wise, it takes a little bit longer, but usually cost is not a big barrier for people who have Badger Care.
Thank you. Other questions, Dr. Schwartz or Ms. Johnson? Yeah, Mr. Raritt.
Thank you both for coming today. Just one comment about this service. It was created through ARPA funding that we received back in 2021. We received from the county board $150,000 to put towards withdrawal management. And this was the concept that we worked out with Western Wisconsin Health, was an outpatient withdrawal management service. So the challenge right now, as alluded to, was the funding for this ARPA initiative will end at the end of '24 without some other sustainable funding source. So that's what the push right now is, to find a way to fund this going forward, because we're finding that it's becoming very effective with persons that don't require inpatient withdrawal management services. And I thank Western Wisconsin Health, Charlie, and Ailey Peterson for all of their efforts to make this happen and work as well as it has.
I was just going to share our appreciation for the county. We would not be able to do this work without the county's partnership, and just really appreciate their support. The other thing that I would add is that we intended this to be a pilot program, so by design, we intended this program not to be large. We were just unsure of what that was going to look like for Dr. Schwartz and his schedule. And so I think the numbers, they may seem small, but that was by design. And so we have found that through this pilot program that it can be very successful, and we're hopeful that we'll be able to continue this in the future, but really appreciate the county's support to do this work. So thank you.
Thank you. Other questions? Lisa?
I just had, can you provide brochures and information on how we can refer people?
Yeah.
Okay.
Yeah.
Any other questions or comments? I'll echo, I think, what Bob was saying. Western Wisconsin Health has been just a leader in the county, and I can't commend Allison Page, who was on this board for a number of years, and now Ms. Peterson, and Western Wisconsin for really being a leader and cooperating and facilitating and innovating. So thank you. If you're exploring grants and you think a letter from this body would be of help in supporting your efforts, we're more than willing to sign on and promote whatever you can do to help relative not only substance abuse, but just all the work that you do at that facility. So thank you. That completes that portion of the agenda. We have subcommittee reports. We've already heard from Treatment Court. The Executive Committee, our next meeting is on August 15 and in my courtroom at noon. Again, if anyone wants to attend those meetings, you're certainly welcome. Or if you have ideas for future agenda items similar to what we just heard, the two presentations, let Phil or I or someone else on Executive Committee know, and I use poor grammar, let Phil or me know. Criminal Justice, Judge Waterman.
Shelby, are you going to help me with this, or am I on my own? Okay, come on up. I'll set the stage while you're on your way. There are probably two things in the criminal justice process that really sabotages the system. One is people who don't show up for court, and the second are people who commit new crimes while they're out on bail, because that just resets the whole system, and it also means that there's another victim or another crime that's been perpetrated. So for the past 2 years, Justice Services has been providing risk assessments for every person charged with a felony who appears through the jail, and there's some others on top of that. And these risk assessments will measure on an actuarial scale the likelihood of committing new crimes, the likelihood of not appearing in court. And that gives the judges information with which to place people in the justice system or the Justice Services monitoring program. The higher risk people are more likely to go into their monitoring program at more rigorous levels than lower risk people. The pretrial outcome and performance measures statistics for Q2 2024 were just produced. I'll let Shelby share the good news.
Thank you. The two main goals of pretrial services are to maximize court appearance and maximize public safety. Therefore, we track appearance rates, arrest-free rates, and then also as a subcategory, violent arrest-free rates. Our arrest-free rate for Q2 of this year was 91%, and our violent arrest-free rate was 98%, meaning 2% of our clients had a new violent arrest. Those are really great numbers in comparison to national standards, and they're consistent with what we've been seeing over the last 2 years. I will note that our appearance rate for this quarter was actually 96%. And again, like the judge said, these are folks who are deemed to be a higher risk to fail to appear in court or be rearrested. So that number is significant, and I want to say the national average is maybe around 85%. So that was great, and up from 90% the quarter before. Do you want me to talk about this stuff too?
No.
Okay.
All right. That's our report. Thank you.
Questions of Judge Warden or Shelby? I'll tell you that the information we get from Justice Support at intake is extremely valuable. I don't want Shelby or her team or Phil to think that we don't appreciate it because we do, and the input that we get almost on a daily basis in terms of people's compliance or lack of compliance, I know is of assistance to the DA's office. I think to the PD as well as defense attorneys as well, because we can monitor and try to keep people on track. So it's really a valuable program. Any questions?
I have one question.
Yes, Sheriff.
What is in that violent 2% category? Is that like a domestic DC? Would that fall into it? Or does it have to go into a abuse or physical?
Yes, so that aligns with statute 969.001, which defines any violent crimes in Wisconsin. It provides a list, and that's what we reference.
Thank you. Domestic violence Judge Black was not available, but their next meeting is on July 17th. We have Michelle Lesha from, on behalf of the Child Welfare Juvenile Justice Subcommittee. Michelle, I think as all of you know, is a supervisor director with the Department of Human Services, primarily in child protection, juvenile justice. So, Michelle.
Well, hello there. Yeah, Anjali gave me like a really well-scripted paragraph, so I'm just going to read that to stay on track. So we just had our last meeting on July 9th, and the things that we were working on, we created a informational pamphlets for parents in CHIPS cases, and those are being printed right now. So prior to going into court or getting involved with the system, we can hand pamphlets out that actually are easily to understand for our parents. We're working on, our youth justice team is working with the DA's office on similar ones for our juvenile in need of protection or services or our delinquency cases. We've been discussing whether it is appropriate to implement a truancy court program here in St. Croix County, or whether we can at least take some techniques from other courts throughout the state. There was a group of us that traveled to Dunn County about a month ago. Phil was a part of it, as well as Kara from his team, to witness Judge Mayer implement her truancy court. And we watched a few cases that had come through, and I believe that there's another one that Sue Garrity had recommended from Troy. Is that, I believe, Troy, that we're going to try to shadow as well to get some ideas on how to implement truancy in St. Croix County, and that requires a lot of effort because we're also looking at a lot of different districts within our county. We have also been looking at different funding sources that come in for youth justice and child welfare, and the different types of programming that we implement with those funding sources. Our next meeting is scheduled for October 3rd at 12 in room 1700 down the hall. Any questions? See, like Anjali did a really good job.
Judge Needham had to step out and address a matter that couldn't wait, so he asked me to just wrap things up. I think the last subcommittee is behavioral health. Bob?
Thank you, Judge. Our last meeting was held on May 20th. Our next one is this month on the 22nd for the Behavioral Health Subcommittee. At the last meeting, we covered updates on regulatory challenges that were referenced today that are affecting hospitals. Charlie Forbush could expand on that, but essentially a hospital can't have two competing licenses in order to expand their behavioral health services under current regulations, which is a challenge. And Pete Van Dusarts was applying for a 988 grant. It was related to suicide prevention and treating folks that might end up in crisis. I was notified yesterday that unfortunately they didn't get that grant. There were updates on recovery support solutions, the ARPA-funded initiative that we just heard about related to withdrawal management. We also applied for an abuse in later life grant that would assist our APS, our Adult Protection Services, with support with the growing numbers of folks being referred to adult protection cases. We don't know the outcome of that grant yet, but it was discussed. We discussed the public safety referendum that the public voted on last spring that funded our 2 co-responder positions going forward, which was good news. And then we talked about legislative actions. One was talked about today with the funding the legislature passed last session that would help to establish regional crisis stabilization urgent care facilities. The other piece of legislation was around an 1115 waiver with the federal government that would allow Medicaid spending in IMD settings, institutions for mental disease. Both of those are pending further development. And we discussed our mental health symposium that took place the HHS sponsored last May at St. Croix Central High School. And Phil talked about substance testing. We're still working on a white paper to look at systems improvements for criminal justice involved persons with behavioral health conditions. This is a larger national than state and now local effort to look at our current system of care that works with persons who enter the court system with behavioral health conditions and how we could better as a county address their behavioral health needs so that they're not cycling through systems, crisis systems, emergency care, and jails. I think that was it, Judge.
Any questions for Bob Raritt? All right, the next item on the agenda is a request for future agenda items. The CJCC maintains an open invitation for all members of the body and also the public to bring topics or presentations that would be of interest to this body. So if you have a topic or a presentation suggestion, please let Phil Golly know or Judge Needham. Are there any announcements? No announcements. Our next CJCC meeting is September 12, scheduled at 8 a.m. for the county boardroom. If there is a change in location, we'll be sure to let everyone know. Thank you, everyone, for your attendance today. We are adjourned.